Cancer is a disease of our cells. Sometimes cells go wrong and become abnormal. These cancer cells keep dividing to make more and more abnormal cells. There are an estimated 2.5 million people in the UK today who have had a cancer diagnosis. This is an increase of almost 500,000 in the previous 5 years.
So my name is Amanda Fry and I am a cancer information support specialist on the mobile information bus.
An estimated 5% of cancer cases in the UK each year are linked to excess body weight. Uterine, kidney and esophageal cancers have the highest proportions of cases linked to obesity.
In Macmillan we have 4 mobile information buses and we take these buses out throughout the British Isles to support people with any information needs that they have about cancer. So it might be that people want to know more about their risk of developing cancer and what they can do to mitigate their risk. But then we support a lot of people whilst they're going through cancer, wanting to know information about their treatment, about how they might be able to find ways to cope or where to go to get help. And then we support people at the end of life when we know that they're not going to get better, or even better when they do survive and when they're given the all clear, and it's kind of the next steps moving on after their cancer diagnosis.
Every 2 minutes someone in the UK is diagnosed with cancer. There are more than 200 types of cancer, each with different causes, symptoms and treatments. An estimated 4% of cancer cases in the UK each year are linked to alcohol consumption.
So last year, all 4 buses saw in excess of 75,000 people. So we reach out to lots of people from all different communities, from rural towns and from large cities.
Smoking causes more than 8 out of 10 lung cancers. Smoking is the largest single cause of cancer in the UK. An estimated 19% of cancer cases in the UK each year are linked to exposure to tobacco smoke. An average of 2,234 teenagers and young adults per year in the UK were diagnosed with cancer in 2009 to 2011. An average of 311 teenagers and young adults per year in the UK died from cancer in 2009 to 2011. The proportion of people living longer after cancer is increasing. The number of people alive for more than 5 years from initial diagnosis is predicted to more than double between 2010 and 2030. By the end of 2016, more than 1,000 people will be diagnosed with cancer every day in the UK.
I love the variety, so you never know what somebody is going to come and ask you about. So it's great that every inquiry relates to a different topic, and it really tests your knowledge and encourages you to go off and to sort of seek out specialist information if you don't have the answers yourself. So there's an element of challenge, but it's also a very humbling job because people will reveal very intimate details about their lives and share with you some of their real anxieties and the things that are really causing them concern. And so it's a privilege to be in a position that you can offer them some support and kind of extend a helping hand to those people at their time of greatest need.
Half of the people diagnosed with cancer now survive their disease for at least 10 years. Cervical, mesothelioma, oral, larynx, esophageal and lung cancers have the highest proportions of cases linked to lifestyle factors. Prostate and testicular cancers have no established lifestyle factor links. More than 1 in 5 of all cancer deaths are from lung cancer. Lung, bowel, breast and prostate cancers together account for almost half of all cancer deaths. Overall, scientists estimate that about a third of 13 of the most common cancers in the UK could be prevented through improved diet, physical activity and body weight.
I would advise anyone who is affected by cancer to reach out and ask for help if they need it. Within Macmillan we have lots of sources of support and different services that we can help people to access, and there's different ones to suit different types of people. So there's telephone support, face-to-face support, and lots of online support as well. So really it's about not enduring that anxiety and that concern on your own. It's reaching out and getting support from either from people in a professional capacity or from friends, family and loved ones. Lean on the people that are closest to you.
Being a healthy weight can reduce your risk of developing cancer. 4 in 10 of cancer cases in the UK each year are linked to lifestyle factors. Eating a healthy, balanced diet may lower your risk of developing cancer. Taking care in the sun so that you don't get burned is important for preventing skin cancer. In the last 5 years, almost 600,000 cancer cases in the UK could have been prevented. It's important to know your body and recognise any changes such as lumps or unexplained bleeding, and to get advice about whether they might be serious. Knowing how your body normally looks and feels can help you be aware of any changes that could be caused by cancer. If you have any symptoms that are ongoing, unexplained or unusual for you, it's important to see your doctor.
One of Macmillan's priorities is to support patients to have their cancers detected early. We know that if we find cancer early, they're much more likely to have a better outcome and to have their cancer treated successfully. So we would like to put the message out there to people that it's important to have good knowledge and understanding of the signs and symptoms of cancer, what to be looking out for, and then if somebody is experiencing any of those symptoms, to seek out help at the earliest possible.